You stepped on something. A nail, maybe. A piece of scrap metal half buried in the dirt. It barely broke the skin. You cleaned it, wrapped it, forgot about it within a few days. The wound closed. Everything looked fine. That was the problem. Before we get into what happens when a microscopic organism turns your own nervous system against you, a quick game. Some myths about tetanus. True or false? Myth 1. Tetanus only comes from rusty nails. False. Rust has nothing to do with it. Clostridium tetani lives in soil, dust, and animal feces. It can get into your body through any puncture wound, a burn, even a small surface cut if conditions are right. Rusty metal just tends to show up in the same places as contaminated soil and organic debris. The rust is a distraction. The dirt is the problem. Myth 2. If the wound heals, you're safe. False, and this is the one that makes tetanus genuinely dangerous. Clostridium tetani is anaerobic. It thrives where oxygen is scarce. A wound that seals shut on the surface is actually creating good conditions for the bacteria to multiply deep in the tissue, right where your immune system has the hardest time reaching. The closed wound is not a sign you're fine. It's a door that just locked from the inside. Myth 3. Tetanus just makes you stiff. Dangerously incomplete. Muscle stiffness is where it starts. What it becomes is a full assault on your central nervous system that can stop your breathing, fracture your spine from the force of your own contractions, and push your heart into complete instability. Calling tetanus just stiffness is like describing a building collapse as a renovation problem. What actually happens when Clostridium tetani gets into your body and starts dismantling the mechanisms that keep your muscles from tearing you apart from the inside goes like this. The bacterium itself is not really the threat. The toxin it produces is. Clostridium tetani releases a compound called tetanospasmin, and tetanospasmin has one specific, devastating job. It travels up your nerve pathways, crosses into your central nervous system, and blocks the release of inhibitory neurotransmitters. Your nervous system normally runs on a balance of signals, some telling muscles to contract, others telling them to stop. Tetanospasmin silences the stop signals. What follows is a body that cannot stop contracting itself. To understand why that is catastrophic, you need to understand how muscle control actually works. When you reach for something, your brain fires the appropriate muscles. At the same time, inhibitory neurons release compounds like glycine and GABA to prevent the opposing muscles from contracting simultaneously. The system is a constant negotiation between activation and restraint. Tetanospasmin removes the restraint. Not gradually. Not partially. It severs the mechanism, then waits for your body to catch up. The incubation period, the time between exposure and first symptoms, runs from 3 days to 3 weeks. The average is around 8 days. During that window, you feel nothing unusual. Maybe some fatigue. Maybe soreness near the wound that you chalk up to normal healing. You're going about your life while the toxin moves through your peripheral nerves, climbing toward your spinal cord at a rate measured in millimeters per day, one rung at a time. The first symptom is jaw stiffness. Not pain, exactly, more like resistance. You try to yawn, or chew, or open your mouth all the way, and there's a tightness that wasn't there yesterday. This is trismus, the clinical name, though it's been called lockjaw for centuries, because that's exactly what it feels like. The masseter muscles, the large muscles that close your jaw, start tightening on their own. At first, it's easy to dismiss. Maybe you slept wrong. Maybe you've been grinding your teeth. By the second day of symptoms, dismissal gets harder. The stiffness has spread. Your neck is rigid. Swallowing is uncomfortable, then difficult. The muscles of your face start behaving strangely. The low-level contraction pulls at your features, drawing your lips back, tightening the skin around your eyes. The result is called rhizus sardonicus, a fixed, forced grimace documented in tetanus cases going back to ancient medicine. You are not smiling. Your face is being pulled into the shape of one. This is also when the spasms begin. A tetanus spasm is not a cramp. A cramp is a miscalibrated signal. A tetanus spasm is a body that receives no signal to stop. The muscle fires and keeps firing, building in intensity, pulling against itself and against the bones it's attached to, with the full force of healthy, well-oxygenated tissue. There is no warning. One moment you're lying still. The next, your entire body is arching backward in opistatinus. The extensor muscles of your back contracting so hard your spine bends like a bow, your heels and the back of your head taking your full weight, while everything between them lifts off the surface. The pain during a major spasm is hard to compare to anything ordinary. It isn't sharp and localized. It's structural. You feel it in your joints, in your spine, in the muscles themselves as they pull past their normal range. In severe cases, the contractions generate enough force to fracture vertebrae, not from an external blow, but from muscles attached to the same bones, pulling in opposing directions simultaneously, at maximum force. Your own body is the mechanism of your own injury. The spasms are triggered by almost anything. A sound, a light, a touch, vibration through the floor, a door closing in the next room, a breath of air on your skin. The nervous system, stripped of its inhibitory regulation, treats every incoming sensory signal as reason for a full muscular response. Clinicians call this hyperreflexia. The practical reality is that you become afraid of any world that contains stimuli, which covers every world you can actually be in. Between spasms, at least early on, there are intervals. You are conscious during them. This is one of the things about tetanus that physicians and medical historians have found most disturbing about the disease for as long as it has been documented. It doesn't touch consciousness. You are present for all of it. You can hear what's happening around you. You can think. You understand your situation with complete clarity. You just can't stop your body from doing what it's doing, and you can't predict when the next spasm is coming. As the toxin spreads further, the autonomic nervous system gets pulled in. This is where tetanus stops being agonizing and starts being directly fatal. The autonomic nervous system runs the functions you don't consciously control: heart rate, blood pressure, temperature regulation, blood vessel diameter. Strip away the inhibitory regulation and the system swings between extremes. Your heart rate surges, then drops. Blood pressure spikes to dangerous levels, then falls. You sweat heavily one moment and go pale the next. The cardiovascular system is being driven by a control mechanism with no dampers, and it responds the way any unregulated system does. It oscillates. Respiratory failure is the most common cause of death in tetanus. It comes by two routes, sometimes simultaneously. The first is laryngospasm, a spasm of the muscles controlling your airway. When those muscles contract, they close off the passage through which air moves. No amount of effort opens the airway during that window because the muscles responsible for opening it are the ones in spasm. The second route involves the respiratory muscles directly, the diaphragm, and the intercostals between the ribs. When those are caught in a sustained contraction, the mechanics of breathing stop. The chest can't expand. Air doesn't move. The time between a respiratory spasm and irreversible brain injury is measured in minutes. In a modern hospital, treatment involves sedation, muscle relaxants, mechanical ventilation, and immunotherapy to neutralize circulating toxin. The toxin already bound to nerve tissue can't be removed. It can only be managed while the nerve terminals slowly regenerate over weeks or months. Patients with severe generalized tetanus can spend 6 weeks or more in intensive care, sedated deeply enough to suppress spasm activity, with a machine breathing for them, waiting for the nervous system to rebuild what the toxin took apart. Survival rates in facilities with full intensive care are reasonable, though not guaranteed. In settings without mechanical ventilation or adequate sedation, the historical case fatality rate exceeded 50%. Without any medical intervention, it was higher. Before the vaccine, neonatal tetanus killed hundreds of thousands of infants every year, transmitted through contaminated instruments used to cut the umbilical cord. The bacterium has been in the soil for all of recorded human history. The scale of suffering before the antitoxin and the vaccine is hard to get your head around, and most people don't try. Here is the full progression, from that first moment of exposure to the point where the body either stabilizes or doesn't. Generalized tetanus, the most severe and most common form. The wound happens. It's small. You may not have even seen what caused it. The skin closes within a day or two. For the next week, nothing changes. You function normally, with no way to know that deep in the anaerobic pocket of the sealed wound, spores of Clostridium tetani have germinated into active bacteria and started producing tetanospasmin. The toxin enters the peripheral nerve endings at the wound site and starts moving toward the spinal cord and brainstem, traveling along motor neuron axons at a pace your immune system cannot intercept. There is no mechanism for detecting a toxin inside a nerve fiber. Around day 7 or 8, you notice the jaw. You try to open your mouth fully and find you can't. It's still mild. The stiffness is there but tolerable, and the temptation to wait and see is real. Over the next day or two, it spreads to your neck and upper back. Swallowing takes concentration. Your face starts to feel tight in a way that doesn't map to anything you felt before. When the first major spasm comes, it is immediate and total. No buildup. Your back arches, your jaw clamps shut, every muscle in your torso fires at once, and the pain is enormous and structural, felt in the bones as much as the tissue. It lasts seconds to a minute. When it ends, you're left shaking, exhausted, and certain, in a way that leaves no room for doubt, that something has gone catastrophically wrong. In a hospital at this point, intubation happens if it hasn't already. A breathing tube goes in before a laryngeal spasm makes that impossible. Sedatives come in quantities large enough to suppress major spasm activity. Muscle relaxants follow. The room is kept quiet and dim. Staff move carefully, speak quietly, close doors without letting them slam. If you're not in a hospital, the progression continues without interruption. The spasms increase in frequency and severity over the following days. Sleep becomes nearly impossible, partly because spasms continue through the night, partly because the hyperreflexia means any sound or movement can start one at any moment. Exhaustion builds on top of everything else. The respiratory muscles become more involved. Each episode of respiratory compromise is a near drowning from the inside, a desperate effort to breathe meeting a chest that won't expand, and an airway that may be partially or fully closed. Cardiovascular instability worsens alongside all of it. Heart rate swings between too slow and too fast within minutes. Blood pressure does the same. The combination of hypoxia, cardiovascular chaos, and the metabolic cost of continuous extreme muscle contractions is a load that even a healthy body can only carry for so long. Throughout all of it, the mind is present. The toxin does not cross the blood-brain barrier in meaningful quantities in most generalized tetanus cases. You're not confused. You're not delirious, not early on. You understand what is happening. You hear the conversations around you. You feel everything. The fact that tetanus leaves consciousness intact is not a mercy. It's just how the mechanism works. Recovery, when it happens, is slow. The effects persist until the nerve terminals that absorb the toxin degrade and are replaced through normal neural regeneration. That takes weeks. In severe cases, meaningful functional recovery can take months, with residual stiffness, fatigue, and autonomic irregularities continuing well past discharge from intensive care. Some patients report sensory sensitivity and muscular discomfort lasting months after the acute phase is over. The prevention is a vaccine. The tetanus toxoid trains your immune system to recognize and neutralize tetanospasmin before it reaches the nervous system. A full primary series followed by boosters every 10 years maintains reliable protection in the vast majority of people who receive it. The disease it prevents is one of the most mechanically brutal infections in human biology. The intervention is a routine injection. That gap should probably give you pause. If you haven't had a booster in the past 10 years, it's worth knowing. Especially if your life involves soil, animals, tools, or any situation where a puncture wound is plausible, which describes most lives. The bacterium doesn't need a dramatic injury. It needs an opening, however small, and conditions that favor anaerobic growth. A deep puncture wound from a contaminated surface provides both. The wound heals, the skin closes, and somewhere inside the sealed tissue, something is already moving. Check your vaccination records. If you're not sure when your last booster was, assume it's been too long and talk to a medical provider. Everything described here is preventable by something available, established, and quick. That's what tetanus does to a body. The distance between experiencing it and not is, in most cases, one injection on a schedule.